Welcome to this informative video on breast cancer surgery and the exercises that support your recovery. Breast cancer surgery can be a challenging experience, both physically and emotionally, but understanding what to expect and how to take care of yourself afterward can make a big difference in your healing process. You are not alone in your journey. The information in this video has been compiled by talking to previous patients who have traveled this road before you. In this video, we'll discuss what to expect after your surgery and, most importantly, simple exercises that can help you regain strength, mobility, and confidence. Whether you've recently had surgery, are planning for it, or supporting a loved one, this video will provide you with helpful tips and encouragement. Keep this video bookmarked, as some of the issues may not occur until later in your treatment. Remember, each journey is unique, so always consult with your healthcare provider before starting any new exercise program. Let's get started on the path to healing and strength together. Hi, I'm Melissa Hoig, Breast Health Nurse Navigator. I would like to talk to you about what to expect after you have your breast cancer surgery. After surgery, your incision will be red, raised, and it can be painful. This usually is just during the first few weeks of healing. When you go home from the hospital, your nurse or your breast surgeon will give you instructions on how to take care of the dressing and when you can shower. When you're at home and resting, try to keep that arm propped on a pillow and kind of out away from your body. That will help with your comfort, and it'll also help with any swelling that can happen following surgery. Over the next few months, as your incision heals, you will notice that it will be getting flatter. Sometimes you can develop what's called scar tissue and fibrous tissue. If that happens, the area could be more painful, and you might have some restriction on how you can move or feel tightness. If this happens, you can do a small massage on that area. What you would do is take your fingers and either go gently back and forth across the incision, or you can do small circles. To help do that, you can use any lotion or vitamin E oil, and that should help soften and break up any of that fibrous tissue. If it's affecting your range of motion and you notice that it's not improving, please let your breast surgeon know, as she or he might need to refer you to a physical therapist or occupational therapist to help with this. After your breast surgery, you might have different sensations along that chest wall or at your incision. This is normal. A lot of times women complain that you have numbness and tingling. It might feel like pins and needles to the area. Others say that they are very sensitive to any clothing or anything touching their skin. This can be common. It's because of the nerve endings. If those nerve endings were cut, these sensations might continue, but if they were just injured, you might regain full sensation where you're not having those problems anymore. There is a nerve that runs the back of the arm, and if we do have to cut that nerve if it's too close when we're checking those lymph nodes, it could cause some permanent numbness and tingling underneath your arm, but it will not affect the function of your arm. Another thing that can happen following your surgery is you could develop what we call is a seroma. A seroma is a collection of clear fluid that develops at the site of the cavity where the tissue was removed. This can happen usually 7 to 10 days after your surgery and after your drains are removed. Some women will find that they go home with a drain. This is a drain that is inserted by the surgeon at the time of surgery, and it goes underneath the skin, and then this drain bulb is hanging out here where you would have to take care of this drain at home. Before you go home, your medical staff will teach you how to take care of this, and this is to help drain some of that fluid away from that cavity so you don't develop a seroma. But it can happen still. If you do develop a seroma, usually you notice that you feel some fullness in your breast. It would still be soft, but it might feel like there's some water underneath there. And some women actually say that they can feel and hear the sound of water in their breast. Like I said, this can happen, and usually your body will reabsorb that fluid in a month or so. Sometimes it can take almost up to a year. If it becomes bothersome or painful to you, or it affects your range of motion, please let your breast surgeon know, as your surgeon could insert a small needle in the office to drain that fluid away. Sometimes you might have to have this done more than once, and it's just something that could happen following your surgery. Another thing that can happen is called a hematoma. A hematoma is a collection collection of blood at the site that you had your cancer surgery. Usually you can tell what a hematoma is because you might have some bruising, more pain at that site, and also it would be hard. If you notice that you do have a hematoma, it's very important that you notify your breast surgeon, as sometimes these will reabsorb into your system on their own, but other times we might have to take you back into surgery and open that area up again just to remove some of that blood collection. Some of the ways that you can avoid developing a hematoma is to follow your physician's instructions about pain medication. When you are using NSAIDs such as aspirin and ibuprofen, that can thin the blood and increase your risk of a hematoma. We would also like you to avoid any bumping of that area or massage or any real tight restrictive clothing or garments during that time. That can also increase your risk of a hematoma. To help with the discomfort of it, you can use a warm compress 2 to 3 times a day to see if that will help decrease the hematoma and provide comfort to you during this time. If you should have any questions after your surgery, please reach out to your breast surgeon and your care team, as they are more than willing to help you during this time of healing. I would like to introduce Anna Most, who is our clinical oncology dietitian. Anna, welcome. I get a lot of questions from patients regarding what they should eat following surgery or before surgery. What recommendations would you give them?
Whether it be following surgery, whether they're having chemo or radiation, the goal is to have a healthy diet with extra protein and nutrients. The reason we need that extra protein is because we have a lot of recovery, we're trying to fight infection, and just have a better outcome from our procedures. So those high calorie, nutrient-dense foods, such as meats, eggs, dairy, yogurt, nuts, seeds, peanut butter, are all really good sources of protein. So getting those good sources of protein are very important for healing. If somebody is having difficulty eating, a lot of times we'll recommend nutritional supplement drinks to get some protein and calories in when eating is difficult.
Now, is there any food choices that we could use to prevent a reoccurrence of cancer?
In general, we say that the diet that is recommended for prevention is also very important for reoccurrence. So the American Institute of Cancer Research recommends a healthy diet with more plant-based foods. So if you look at your plate, what is recommended is about 2/3 of that plate should be fruits, vegetables, and whole grains. The other third should be animal proteins. So really trying to increase our plant foods from those fruits, vegetables, beans, good plant-based sources of protein, and decreasing those animal proteins is what is recommended. And at the same time, trying to stay away from things like highly processed foods, processed meats that are high in sodium and other chemicals is also recommended for that healthy diet, because the long-term goal is to maintain a healthy body weight and also just have a good, well-rounded, healthy diet.
Okay. Now, we have a lot of questions from our breast cancer patients regarding soy and soy in their diet.
And the reason soy is such a question with our cancer patients is because soy in our body has estrogen activity. And what most experts agree on is whole soy foods are fine. So things like soy milk or tofu or miso, those whole soy foods are completely fine. It's more of the supplemental soy that becomes more of an issue. So staying away from things like soy supplements or foods that are fortified with soy, like soy chips or soy cereals. Stick with the whole foods, and that's much safer.
Now, is there any so-called superfood or supplement or herbal supplements for nutrition that patients can take?
Unfortunately, no. So we know that superfoods, that's really not a thing. We know that we want a good, well-rounded diet with lots of different foods. So focusing on produce and plant-based foods that are very colorful, like melons and berries and tomatoes, dark green leafy vegetables. Getting a good combination of a lot of colors is very important. On the note of supplements of any kind, it is highly recommended that before you take any supplements, that you talk to your healthcare provider, because there are supplements that can actually increase risk of cancer. And so we don't want to have those for sure. And so making sure that every supplement that you are considering taking, that you talk to your doctor first.
And that includes herbal products too.
Correct. Yes.
Anna, what can we do if a patient wants more information?
Patients can always ask their doctor for a referral to the oncology dietitian, which is me. And so you just ask your doctor for an ambulatory referral to nutrition services, and that will allow a referral to come see me in my office at the cancer center.
Wonderful. Thank you so much.
You're welcome, Melissa.
I would like to welcome Jennifer Root, who is a physical therapist that specializes in cancer rehabilitation.
Hello.
Hi, Jennifer. We hear a lot about after breast cancer surgery, lymphedema. Can you explain what lymphedema is?
Sure. So edema just means swelling. And so lymphedema is swelling that results from a problem of the lymphatic system, so a slowdown or a backup of some kind. Now, most people aren't even aware that they have a lymphatic system. It's not something we hear a lot about, but it's actually an important network of vessels and lymph nodes and ducts that run throughout your body, all over, legs and arms and hands and face. And it brings fluid back to your heart. It's kind of like a one-way street that more or less runs parallel to the veins. And it helps with that fluid regulation in your body, but it also helps with the immune functions of your body. So as fluid comes back to the heart from all over, the fluid comes through lymph nodes and is cleaned. And then lymph nodes get rid of anything that's in there that shouldn't be, whether that's waste products or bacteria or what have you. Well, sometimes cancer cells find their way into those lymph nodes. And so as part of your cancer treatment, your medical team may need to remove lymph nodes or irradiate them with radiation to make sure that cancer cells don't go elsewhere in the body. And so then when you have lymph nodes removed, you can get a swelling or a backup of fluid in the body. Specifically relating to breast cancer, if you take lymph nodes out of your armpit area, you can get swelling that backs up into your arm, into your hand, or sometimes into the chest wall or the breast itself.
And what does this feel like for a patient when this happens? How would they know?
Well, usually the first thing that they feel is just a heaviness or a fullness or a thickness in the arm. But then perhaps you might be able to see physical changes. Sometimes the most noticeable symptom is you lose your knuckles, like you just can't see the definition as well anymore, or the definition in your forearm or your elbow. Sometimes it can actually even be reddened or warm to the touch, and you can see these very visible differences. Other things you might notice is that your watch or your rings feel tight, or your clothing just feels tight on that side. It's usually not painful, but it's often just uncomfortable.
And when would this start?
Well, it really varies. It can start as soon as right away in the first few weeks after surgery. More commonly, it's a few months, like 3 to 6 months out, but it can actually happen even years after surgery. I've had patients where they do fine and have no symptoms whatsoever for like 5 to 7 years, and then something happens that triggers it. So it can come on much later.
Okay. Does everybody that have lymph nodes removed have this problem with lymphedema?
No, thankfully. The risk if you just have a sentinel node biopsy and just have a few lymph nodes removed is actually very small. Statistically speaking, it's somewhere around 10% or less. However, with more lymph nodes being removed, or if you have radiation to that area, your risk does increase.
And how would we treat that?
So right away at the first sign of any symptoms, you'd want to see your healthcare provider to get help for it. This is not something where you just let go for 6 months and hope it gets better. We'd really want to treat it right away. The first thing we would do is get you a compression sleeve or glove to help control that swelling. That would be the first line of defense. Then other things would be a special kind of massage that we do. Either a therapist would do it for you, or the patient or their loved one can learn how to do the massage at home, or both. And there's also things like specific exercises that we do, and there's pumps and other kinds of compression garments and things that we might use as well.
What can we do to reduce our risk of getting lymphedema?
Great question. Research has shown that the number one thing to do to prevent lymphedema from occurring after these kinds of surgeries is maintaining a healthy diet and exercise. Gaining weight just adds bulk to the arm, and that just makes the body have a harder time processing that fluid. And so weight gain is the key risk factor for developing lymphedema after these surgeries. But otherwise, you want to try to protect the arm somewhat from injury and trauma. So doing things like putting lotion on your skin and taking good care of your skin to prevent any kind of injury or infection, wearing gardening gloves or protecting your skin from harsh chemicals and those kind of things. And if you do get a cut or a bee sting or a bug bite or something like that, you'd want to treat it right away. Wash it good with soap and water and apply a topical antibiotic ointment in hopes of preventing a full infection. Then if you do show signs of an infection like redness or warmth or streaking or itchiness, you'd want to get to your doctor right away and get antibiotics. The reason for that is that infection, your body fights infection by sending fluid to the area, and so that could trigger the lymphedema. Other things that you might want to be considerate of is if you fly a lot, you might want to have a compression sleeve before you do those kinds of activities. And then just being mindful of your arm and watching for signs of swelling and getting help right away.
We get this question a lot from patients. What about blood pressures, blood draws, injections in that arm? Yeah. Where are we standing with that today?
So if at all possible, offer the other arm. It's just common sense, particularly for injections, IVs, immunizations like your flu shot or COVID shot. Offer the other arm. Just prevent that little bit of trauma to the arm. Why not? If you forget and it's a once-off kind of thing, it's not probably a big deal, but as a general habit, it's best to just offer the other arm.
Now we hear about cording. Some patients call and talk about cording to us. What is cording and how does that feel and what do we find with that?
Sure. So cording is another thing that can happen when lymph nodes are removed. So the lymph vessels that would be coming up the arm and into the lymph nodes in the axilla, when those lymph nodes are removed, those vessels get dried out and kind of stiff and tight. And it can be painful or it can limit your range of motion. You can even actually see visible cords or almost like guitar strings are strung under the surface of your skin. And they can start up in the axilla and even be a little bit in the chest wall and then go down the forearm, potentially even all the way to the wrist or thumb. And it just feels really tight, like a tight band. People will call it like I have a rubber band under my skin, or it's just taut. And as I said, it may limit your range of motion. So stretching can help, just general stretching like we'll show in some of the exercises later in this video. But if it becomes a problem where it's painful or really limiting you, that's where a therapist, a physical or occupational therapist, can help do some specific massage techniques to try and release those cords.
And when do these develop? When does cording develop?
So kind of like lymphedema, it varies. It can be a few weeks or even a few months after surgery. And radiation can trigger them or make them worse.
Well, thank you.
You're welcome. So I know that exercise can seem really scary, especially after you've had major surgery. But really, exercise can be very beneficial, even in those early days, to help reduce pain, restore your range of motion, and improve your strength and your functional mobility to get you back to doing life like you want to. So we're going to go over some exercises today to help, and I've invited my friend Courtney to come and help me demonstrate these. Courtney herself is a breast cancer survivor who came through therapy with me and did all of these exercises and did so great. And so we're going to show you together some things that you can do to help you heal as you come through this journey. So exercise is not something to be afraid of after these kinds of surgeries. Even on day one, there's a few things, now gently of course, a few things that you can do right off the bat. The first is just being mindful of good posture. So Courtney here, we're gonna just go through a few things, and so I want you to sit up nice and tall and just kind of bring your shoulders back. There's such a tendency just in life for us to kind of cave in and be forward and flexed, and particularly after surgery when you're sore and just feeling uncomfortable, that just tendency to cave in is so strong. But we want to try to fight that and bring those shoulders back. You're not going to rupture any stitches. You're not going to disrupt any drains by just simply maintaining good posture. And then when you maintain good posture, you can also take better deep breaths. So go ahead and take a few nice deep breaths, Courtney. So again, that can seem a little scary when you have brand new incisions, but it's not going to rupture anything, and it will be of help to just have better oxygenation for healing. Just taking a deep breath is always a good idea. Then a few other things that you can do right off the bat just to help with circulation and keeping your body moving a little bit better is moving your wrists. So we'll go ahead and do some wrist circles. One direction and then the other. And then making a fist and then a star with your hands. Just kind of pumping those hands and arms to get your blood flowing a little bit better. Keeping the system active during the early phase of healing. So these things you can do from surgery day 1 up for a couple of weeks until the drains come out or until you feel ready for more active exercise. So after a couple of weeks, particularly after your drains come out, you can start doing a little bit more active exercise. One of the first ones to try is putting your hands behind your head and bringing your elbows back. And that can be a really tight area that needs to be stretched for some people. And this is particularly important if you are going to go on to have radiation therapy, because this is the position that you'll need to be in while you lay down for radiation. So it's a good idea to practice that position and stretch those shoulders back and push those elbows back to be able to lay comfortably in that position. Then another motion that's often tight after surgery is the ability to reach forward and up. So there's a few different ways we can go about stretching that. First of all is just using the arm itself. So go ahead, Courtney, and just reach up as far as you can. Reach up overhead. And then you can even make that fist pump overhead while you're up there and come back down. So if you have difficulty with the motion, then this is probably a good stretch that you need to do. If it's a challenge, you could use a stick of some kind, a wand, a golf club, a yardstick, to use your other hand to help. So go ahead and use that to help up and overhead. So that's another option. You could also do this laying down in your bed if you wanted to let gravity help you stretch. And then a third option would be to use a wall to help. So you just face the wall forward and slide up. And let the wall be your assistance. Help lean into it to really stretch the front of the shoulder. A second motion that's often difficult after breast surgery is reaching out to the side. So once again, we could start with just the weight of the arm and reach up and down overhead and just simply stretch it that way. If that's difficult, you can once again use the cane or a stick and use your other hand to push it up there. I'll let you try that one. And then thirdly, you can use the wall once again. This time you face away from the wall or sideways towards it. Put your pinky border of your hand on there and then slide up the wall. Slide up and down that way. So stretching that side of your chest and the side of your shoulder. If that's difficult, another option might be to do that same sliding forward or sideways on a table instead of the wall. So as you slowly gain strength and mobility, the key after surgery is to start low and build slow. So start with easier things and then slowly build up. So after a few weeks, you could get more aggressive with your exercise, such as using some weights for those elevation ones. So we can do the forward motion with weights, up and down, do a couple of those. And then we can do the side. And then another option would be to start here and then push straight up overhead and just really stretch. Again, starting with low weights. These are 2 pounds, so start with pretty light ones and build slowly. A good rule of thumb is to start with 8 to 10 reps. Do 2 sets and then slowly build in terms of number of reps and then the weight you're using. A couple of other good ones to do would be to do a wall push-up. So find a wall and just lean into it, letting your elbows bend, and then come back out. And that gets both a good stretch as well as some strengthening. And then finally, a good stretch that's pretty much good lifelong for you to do is a door stretch or a corner stretch, where you'd place your arms on either side of a door or a corner. We don't have a good door or corner here to demonstrate, but you put your hands up and then just lean into it and hold that stretch for like a good 10 seconds or so. Get a nice good stretch across the chest wall. Then certainly you could build up exercises in various forms, Pilates or all different kinds of things that you could do. Just build slowly and gradually. In addition to these exercises, we at My Michigan Health have put together a series of videos for breast cancer survivors for exercise. We have 3. One is a cardiovascular exercise, one is a resistance training video, and one is for flexibility and mobility. You can find these videos at mymichigan.org/breastexercise.